Hello.
I heard that we're in between happy hours, so
Yes.
This should be fun.
Yes, it should be fun. I was just joking that backstage, I hope someone is taking a shot every time someone uses the word AI, but we'll probably talk about it too. So I have a ton of questions for you about your role as the Chief Medical Officer of HERS, which is part of Hims and Hers, the telemedicine company. But before that, I want to avoid bearing the lead, so to speak, in journalism phrasing. You all just raised $1 billion.
Yeah.
What are you using that capital to do?
Well, I think that there's a lot of things when we think of expansion, but also what we're doing in order to make healthcare accessible. That really is the tenet of what our platform is providing accessible care that's consistent and reliable. And so when you think of a raise, you think of what else can we do that's going to make it more efficient, stronger, but also expanding as well.
Got it. Okay. So obviously you're the Chief Medical Officer, as I said, of HERS. That is a new role for the company, Hims and Hers. Hims also has a Chief Medical Officer overseeing all of it.
Right.
Tell me why you joined and what you work on.
Yeah, when you look at Hims and Hers, it has been pretty aligned as far as how they were incorporated. Hims was first and Hers was shortly thereafter. So when we look at the expansion, that is always the goal. When you're thinking of women's healthcare, there really needs to be kind of this way to reach women. And as you can tell, as an OBGYN, but also a woman, I think that that is imperative that we are really dialing into the need for women's healthcare, but also what is that relationship that we're going to foster? And that's why I came on, because I'm very passionate about not only, what happens in between a woman and her healthcare provider, but what goes behind her ideas of how she thinks of herself in health. And that's something that we really wanted to hit home, and that's why I'm here.
Yeah, I mean, you were a doctor for 20 years before joining Hims. Why did you make the decision to go from traditional healthcare to, what is still sort of a startup, even a public company?
I think that, traditional healthcare has its strengths, and obviously that's where most of our healthcare here in the US is focused on, is again in this structure of traditional healthcare. But there are different ways in which you see healthcare being innovative. And the way to push that is to find different avenues and different ways to reach patients. The other thing is that when we think of health outcomes, just in general, when we look at being a country with one of the best, if not through research, but healthcare in general, in what we can do for patients, we still have a lot of work to do. And in that means, how are we going to do that? And I think that telehealth, you'll see through the pandemic, that really changed the structure of how people access healthcare. And we even saw that in the traditional model in how we had to very quickly pivot or not. I think that there were a lot of patients that were left behind in the way that they were able to get their healthcare, but also a lot of healthcare providers and also institutions that weren't able to pivot that well. So I think innovation is key for making sure that we're reaching everyone accessibly, and also for the resources that we have available. So I think that it's a beautiful way to have more variety for patients to get the care that they need through different avenues.
What areas of women's health is Hims and Hers seeing the most growth currently?
Yeah, that actually in the weight loss category. So the weight loss category has really kind of been one of our best features when we think of what women are trying to access. But as we grow, obviously we know that there's going to be a push into the mid-age of women's healthcare. As they go through that, we're seeing a lot more in perimenopause and menopause, which is rightedly so. I think that's where we miss a lot of women when we think of, comorbidities and how women are aging. Some of the diseases that they get later on in life is because they weren't tended to in that mid-health or that mid-health stage. So as we start to grow, we're going to see more that's going to be able to permeate that specific transition so that we can have better health outcomes for women. Because women typically live longer than men, but we live more years in poorer health. So there's a gap that needs to be taken care of, but most times when you look at the research and the data, that has to be pulled back to being more preventative in that time frame, usually between the ages of around 45 to 55.
So since dozens of companies are seizing on this perimenopause and menopause stage, what is Hims and Hers specifically doing or planning to offer? Yeah,
when we look at weight loss is actually one of those key features, because usually women will start to have some of their weight struggles or issues around the mid-age area, but also when we think of hormonal health, what that looks like for women, because again, that's something that biologically starts to change and no one has control over that. But if we're able to offer I guess, solutions for women to be able to, again, make that transition, not only for comfort, and how they're feeling, but again, looking at long-term outcomes for women's health. That's really where we're starting to see the needle, kind of change in the right direction.
Yeah, you've told me previously that you've seen a surge in awareness around women's health. I feel like we're seeing that as well. We've been writing about it a lot at Axios. What do you think is driving that surge in awareness right now?
As a provider and a physician, I think that there were things that we were not paying attention to. But also, when you think of women, they are so busy taking care of everyone else that they often forget to take care of themselves. And so when you kind of put those two together, you see that there's going to be a gap. There's going to be a gap in actual healthcare. There's a gap in research when we think of equity and how we actually look at research that's devoted to new medications or just how do we prevent certain diseases. And I think that we really need to make sure that we're not missing that stage and being critical for women to be able to pay attention to themselves, get the health care that they need. But also, when we think of a telehealth platform, we know that one of those things is convenience and flexibility, and that is being able to offer women at the time of their need the health care that they want.
Yeah, you mentioned weight loss. What is next for Hims and Hers in the GLP-1 business? Are we going to see more branded partnerships like the one that you did with Novo?
I think that could be a possibility. I think this is just the start of what collaboration and partnership looks like. And I think that it actually, when I think of innovation, I think that that's the best way to do it, is kind of the beauty of the blends and how you can take something that you're very strong at and being able to incorporate or hold hands with someone else who has strengths in other areas. So with the GLP-1s, we do that really well. And one of the key features is, what is the continuity of when people start something? Is the consistency and the sustainability of what they're able to take. So for example, in the GLP-1 sector of our business, we see that there's only maybe 13% that will discontinue. When you look at a traditional healthcare setting, that again can be as much as 30 to 40%. So again, what makes those changes is being able to be accessible, but having that asynchronous kind of interaction and at the time of need. So if someone at 2 a.m., because that's the free time that they have to be able to interact with their provider, then that's available. And I even see that, when I was in the traditional healthcare setting, is after certain hours, it really is hard, even from our end, to provide the care that we want with someone when the building's closed, the office is closed, or the phone lines are shut off. So creating kind of a way to overcome those barriers is only going to make healthcare more accessible.
What's your view on compounded GLP-1s? I know you've been offering them.
Yeah.
Do you see a future in continuing to offer them?
Yeah, I think that there's a lot of myths or misunderstanding when we think of compounding. And compounding really has value add when we think of the full context of how we are able to offer medications and drugs to the population. And for our particular facilities, we have them where they have their own FDA being able to be entered into cleared, and also that we have very good eyesight on what's going in and what's coming out, because it's not through a third party. And a lot of people do use third party, and we do not do that. The other thing is there are a lot of things that people are unaware of what that means with the scrutiny of how you make a product, how you're able to offer maybe certificate of analysis with each batch that goes out. So there's transparency. And transparency in any part of medicine, whether it's compounding or not, really has to be kind of the forefront part of what's being compounded or what's being manufactured, what's going out to patients, and what are those side effects that may come, and being able to say, this is what it is, and this is what we're offering, and we do that, I would say, outstanding.
If a patient were to ask for a branded GLP-1, would you ask them whether they wanted a compounded version first?
You mean through the platform? Mm-hmm. I think that is patient autonomy. Patients should be given, this is how healthcare should work, is we're giving you the education, the information for you to make an informed decision. That goes across the board. It goes whether you would like a surgery or not. It goes if you want to try a medication for the disease that you have.
Right.
And that's exactly how they enter the platform, and being able to take what they need, and they get to decide.
Yeah, I just mean specifically if somebody asks for a GLP-1, do you suggest a compounded version first?
No, I don't think that's necessarily how that conversation goes. I think there's many ways the conversation goes in, again, hearing where the patient's needs are, what the patient is able maybe to afford, where they are, and how they're going to access that medication.
Okay. You've said equity and accessibility are very important to you, part of the reason you joined Obviously, Hims is a cash pay only business. You do not accept insurance. How do you square those two things?
I think you square those two things when you think of healthcare and cost right now. A lot of patients, even who are insured, do not have the ability to afford what their insurance offers. And so because of using compounding, that is one way to actually, and owning your own facility is a way to drive down the cost so the patient has access and has the ability to get the affordability to access to what they need. And so there is sometimes messaging in how patients understand what they are able to be afforded based on if they're insured or not. And many times when you look at the outcomes, what a patient would be willing to do in order to get a certain outcome, that really goes with the individual, where they are and where we're able to meet them. And many times, even if they're not able to afford a certain medication or a drug through insurance, then a patient has that ability to search elsewhere for a product, and that's what we're able to offer. And I think that patients, we underestimate them. We underestimate exactly what they're willing to do in order to get the outcome that they want. And a lot of times that is dictated to them in the traditional healthcare model because that's how it's been set up.
Yeah, you've been talking a lot about your owning pharmacies and being able to produce all these medications on your own.
Yeah.
Is some of the capital you just raised going to go towards building more pharmacies?
Well, because we have expansion. So for example, with HERS, as we're doing more women's health, that means expansion, and what that means, more facilities. So possibly some of that may go to that, but I think that there's never one thing that all the money goes to. So there has to be a lot of different things where that goes to, and that's definitely one of them.
Definitely. Obviously, there's been some criticism around telehealth not being able to provide the same quality of care as traditional medicine. I feel like you're the perfect person for this question since you've worked directly in traditional medicine and now you work here. What would you say to those criticisms?
Criticism for telehealth has been ever since we started doing telehealth, which has been years, and we haven't really seen the influx in traditional healthcare settings as much as we actually should. And during the pandemic is the perfect example of where patients really realize the importance of being able to access their healthcare provider at all times. And so now that we are able to do that at a time of need, when a patient is able to be able to access the healthcare they want and desire, I would say that the scrutiny comes with maybe not being able to see maybe someone in person. But when you think of healthcare in general, it has to go with what is the patient coming in with and where can we meet that need. And I think that should be the bottom line of how we think of healthcare in general. And there are a lot of barriers that come with when you think brick and mortar, in that you do get to see your provider, but it doesn't necessarily mean that you always have to see your provider in person. And when we think of disease prevention, most of the times, most of the data does show that there usually is more disease progression because there's a lack of intervention or communication because you're not able to see your provider as much. So when we look at actual prevention, one of the key factors is being able to guide your patient through that process and maybe having to take a medication, how to take it, how often, answering the questions where they have concern or even hesitation or fear. And so if you're able to meet that patient and drive those things down and give them more empowerment and reassurance, that's where you'll actually see more success and add value to the patient's outcome.
Yeah, I guess what I was thinking from my own patient perspective is about care coordination and making sure that all my providers know what medications I'm taking, when I'm taking them, and that they don't conflict. How do you handle that?
That's the beauty of being able to say, I have this medication, I don't know. So that would be concern, that would be with hesitancy. And that's where the patient has to be empowered in themselves to ask the questions. And that's what we're able to foster because we have so much communication with them. So that comes with relationship. The more that you are comfortable with someone, the more that you feel safe as a patient in that environment, the more that you're willing to ask the hard questions. And that's where we can kind of get them to the better part of their care.
Thank you. Anything we should look for in terms of what's next for the company, specifically in women's health?
Yeah, I think in women's health, we are a big part of the population, and we're not going anywhere. So I do think that we have a demographic that is thriving. We have a demographic that really is starting to show their power in how they would like to show up in life. But again, going back to how we started, is that gap in women living longer but in poorer health for a longer time, is that women are aware of that and they're starting to use their voice. So as we expand in the HERS platform, I am so excited to be able to showcase that mid-age healthcare, and I know that we're going to even do more than that, even when you're looking at now how we can allow women to thrive even past that midlife stage. So make sure you stay tuned. We have so much coming in the Hims and Hers platform, and I'm so proud that we're able to be here.
Awesome. Well, I can't wait to hear more about that.
Yeah.
Let's keep in touch. Well, thank you so much.
Thank you.